Hello friends, let us now learn about this question. A section of adrenal cortex shows microscopic appearance of 36-year-old man with infective endocarditis from side A. See, what is this process? This is infective endocarditis, and this is the thing which is asked. Here you see a pale region with loss of nucleus. Here you can see clear nucleus which are blue colored, but in this area there is no nucleus which is seen. So this is a coagulative necrosis. And how does this lesion resolve? This here or the whole necrotic cells undergo autolysis and degradation, and these are phagocytosed by the macrophages, and finally this will form a fibrous scar. Thank you for watching.